I'm going to talk just briefly about what the Criminal Justice Coordinating Center of Excellence is in Ohio. Our mission is to encourage communities throughout Ohio to forge collaborative relationships between the mental health and criminal justice systems so that individuals with mental disorders receive the care that they need. What in the world does this have to do with campus safety and campus mental health? Our most visible success in Ohio at the Criminal Justice CCOE has been the widespread diffusion of crisis intervention team training programs in Ohio. CIT, if you're not familiar with the program, is a community collaborative partnership program that trains law enforcement officers and other emergency first responders to recognize signs and symptoms of mental illness and ideally results in a better intervention and better involvement of a crisis response for individuals and police officers. In Ohio, we are proud we have over 3,600 law enforcement officers trained through CIT programs. That's about 11% of law enforcement officers in the state of Ohio. We're a national leader in the number of law enforcement officers trained with CIT. We've got 342 agencies in the state. And we're also a leader in campuses. Right now we have 245 campus police or security officers trained in CIT at 47 campuses in Ohio, so we're very proud of that. It became a priority to promote CIT training on campuses in Ohio. We received a grant from NAMI Ohio to incentivize programs to include campus security officers and campus police officers in their trainings. And we received a TSIG award to work with counties to start or expand their CIT programs to include campus police and campus security. Since then, we're grateful for the supportive funding from TSIG to expand campus safety initiatives beyond just promoting CIT on campus. We wanted to address mental health on campus in a more comprehensive manner. Obviously, as Dr. K mentioned, deaths on campus are more likely to be the result of suicide than a homicide. And Virginia Tech and similar incidents often are murder-suicides. So it's really important to focus on some of the preventative measures that can be taken on. Prevention of these incidents requires a much more comprehensive approach that includes a number of different issues, including suicide prevention, substance abuse issues, etc. So as I mentioned, we wanted to keep our focus on CIT on campus, but broaden that by looking at some other issues, including education and awareness, outreach, stigma reduction, and utilize the strength and resources of our state and local partners to really try and address systems issues that may hinder the effective use of mental health services on campus for individuals with mental illness. So what we're doing is focusing on prevention of crises on campus by looking at appropriate training for campus police and security, promoting CIT, promoting early identification of mental health problems, help-seeking behavior, and stigma reduction. We're trying to better understand counseling services and health services both on campus and in the surrounding community. Obviously focusing on suicide prevention and identifying and overcoming those systems issues and barriers between the campus and the broader community mental health system. We're now in our third year, where we have been working with communities to develop new and innovative programming that addresses one of four components, either the crisis intervention team on campus, a mental health education awareness programming on campus, suicide prevention, and stigma reduction campaigns. One of the other projects that we've been working on in Ohio is to conduct a survey of campus and mental health boards. We're very interested in the connection and the relationships that are built between colleges and universities and their surrounding communities. So we conducted an exploratory kind of first-of-its-kind study where we distributed surveys to deans of students at Ohio's colleges and universities, as well as to the directors of the corresponding mental health services boards. We are focusing on the types of services that are available on campus in the community, their perceived adequacy of services to meet demands, and the process of referral and collaboration between the campus and community mental health system. So I'm just going to briefly discuss some of the results from that study. We're still working to disentangle the two data sets, but it's pretty interesting findings, pretty interesting stuff here. The majority of the sample acknowledged that students are referred to community mental health agencies from the campus. 78% of our sample agreed that there is no formal formal protocol in place to address those referrals, however. So I think that indicates that there is a lot of room for establishing some formal relationships between campus and college mental health. 50% of the deans that we surveyed felt that they did not have an adequate number of mental health staff on campus to meet the students' needs. The majority of our sample did report that they felt their staff were adequately trained. I think it's just a numbers issue here. The most common reasons that students were referred to the community-based, publicly funded mental health services were that the student required long-term therapy beyond the limits of service at the campus. The campus-based center staff were not able to respond to the presenting issue due to time limitations, etc. The student required medication, or there were inadequate resources for campus-based center to meet the demands. In general, the common barriers for students that were reported to access the campus mental health services were that students were not aware that they needed services, they were not familiar with available services, perceived stigma associated with mental illness, and insufficient staffing. And finally, another interesting finding from this study is that most of our survey respondents were dissatisfied with how knowledgeable students are of mental health services. Students need to know more about what is available both on campus, in the community, and how to access those services. So some of our preliminary conclusions from this exploratory study indicate that attempts are being made to coordinate services between the campus and the community, but there's definitely room to strengthen these and formalize these relationships. So in the future, we're going to try and continue to disentangle how this process of referral and just working together and process of collaboration between campuses can be strengthened. The first training was conducted at Shawnee State University and was very well received. The key audience there is college university staff and faculty. And we are also hosting tomorrow a psychological first aid for colleges and universities, which came out of the ODMH University Linkages Committee, training provided by Dr. Craig Vicchio, and Dr. Carol Yokin from the University of Cincinnati. They've adapted the psychological first aid model for college and university community and are offering trainees in Ohio. One is tomorrow, and we will actually be filming the training. If you don't have an opportunity to attend, I know some of you in the audience are signed up to be participants, but if you don't have an opportunity to attend, we are proud to offer that training on our website. We're going to be filming the training, and we'll have that available on the Criminal Justice CCOE website shortly.